This 267-page document is the 2025 annual report of the Boards of Trustees of the Federal Hospital Insurance and Federal Supplementary Medical Insurance Trust Funds, what I just call the Medicare Trustees Report. And in this report, we get to find out what they are estimating the 2026 Medicare premiums, deductibles, and copayments to be. So in this video, we get an early look at what the powers that be estimate your Social Security cost of living adjustment to be and Medicare premiums, deductibles, and copayments will be for 2026. Plus, near the end, I'm going to tell you where COLA falls short for Medicare beneficiaries and why it is critical. Hi, I'm Chris Prying, the Medicare analyst. I'm a licensed agent in 16 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be very important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. Before I get started, if today is your birthday, Lionel Blue said, "To my surprise, my 70s are nicer than my 60s, and my 60s than my 50s, and I wouldn't wish my teens and 20s on my enemies." So let's start with the estimated Medicare premiums, deductibles, and copayments that are coming for 2026. Part A, the premium is going from $518 to $563. Now you may be thinking, I've never heard of a Part A premium, or I don't have a Part A premium. And that is true. Most people don't. But if you haven't paid into the system for 40 quarters or married to somebody that paid into the system for 40 quarters, then yes, you would have a Part A premium. The Part A deductible is going to go from $1,676 to $1,716. Your copayments from day 61 to day 90 are going to go from $419 to $429. And then your copayment from day 91 to 150, which is where you start eating up your lifetime reserve days. You get 60 of those, and that's going to go from $838 to $858. Skilled nursing copayment from day 21 to 100 is going to go from $209.50 to $214.50. Then for Part B, the premium is going to go from $185 to $206.50, and your Part B deductible will go from $257 to $288. What about Part D? D for drugs, the only letter that really makes sense when it comes to Medicare. Your base premium is going to go from $36.78 to $38.99. Now, this premium is solely for the purpose of calculating the Part D late enrollment penalty. The deductible, or the maximum deductible, is going to go from $590 to $615. Your initial coverage limit is going to go from $2,000 to $2,100, and then your catastrophic is going to start at $2,100 instead of $2,000 for next year. What about IRMAA, your income-related monthly adjustment amount? So if you are a high-income earner, or perhaps you've sold a house and didn't do a 1031 exchange, or now you are starting to withdraw money from your investments, your IRAs, your 401ks, and you start pushing up your modified adjusted gross income too high, then you will get hit with good old IRMAA. So for next year, those brackets are from $109,000 to $137,000 for a single filer, or $218,000 to $274,000 for a married couple, and that additional premium will be another $82.60. Then the next bracket, $137,000 to $171,000 for a single filer, or $274,000 to $342,000 for a married couple. Now you got an additional premium of $206.50. The next bracket, from $171,000 to $205,000 for a single filer, or $342,000 to $410,000 for a married couple. Well, guess what? You get an additional $330.40. Then the next bracket, from $205,000 to $500,000 for a single filer, or $410,000 to $750,000 for a married couple. Now you're paying an additional $454.30 additional. That is per person if you are a married couple. More than $500,000 for a single filer, or $750,000 for a married couple, well, that's an additional $495.60. And by the way, in this Medicare Board of Trustees report, you also get an idea as to not what is coming just for 2026, but you could actually see what is being prognosticated all the way to 2034. Of course, these are not etched in stone, but give you an idea of what might be coming. Okay, next. What about Social Security COLA, cost of living adjustment? That's probably what more people are interested in. In 2025, the COLA was 2.5%, and the Senior Citizens League is currently projecting another 2.5% increase for 2026. Your COLA is based on the percentage increase in the Consumer Price Index for urban wage earners and clerical workers. From the third quarter of last year, a COLA was determined to the third quarter of the current year. If there's no increase, then there can be no cost of living adjustment. You can see the links in the description for more information on COLA. So how does a 2.5% increase compare to history? The average over the past 50 years has been 3.748%. The average over the past 30 years, much lower, less than half, has been 1.52%. And then the average over the past 20 years has been 2.615%. So a 2.5% increase is fairly close to average over the past 20 years. And in case you ever wonder how your Social Security income compares, well, the average is $1,917 per month for an individual, $2,753 for a couple. Men, the average is $2,057, and for women, it's $1,643. If the average person is getting $1,917 presently, then they will get an additional $47.93 per month, or $575.16 per year. In case you didn't know, Social Security is a guaranteed annuity with built-in inflation protection. And if you happen to be the type of person that likes predictable income and you are concerned about having enough predictable income years down the road, and you think either you or your spouse especially will live another 25 years after turning 65, then you might want to consider creating an additional guaranteed income for life with inflation protection by purchasing a non-variable annuity. You might be very, very surprised how popular annuities are among baby boomers these days, and they continue to grow rapidly as a means for baby boomers to protect themselves against living too long and running out of money. But that is a subject for another day, and yes, I can help with annuities if that makes sense to you. So where does COLA fall short? Let me touch on something that is critical. Generally, healthcare inflation has outpaced regular inflation. In the past 25 years, regular inflation has gone up by 86.1%, whereas healthcare inflation has gone up by 121.3%. Here's why this is critical that you just don't hear about. Because the older you get, the more likely you are going to need medical care. So the rising cost of care has a greater impact on you as compared to someone in their 30s. In addition, if you have or are considering a Medicare supplement and you've watched some of my videos about the very high premium increases, then you know or should be able to figure out that a good bit of your COLA increase is going to get wiped out by your Medicare supplement premium increase. If the average Medicare supplement premium is $217 per month and the average premium increases are 15%, then that's an additional $32.55 per month or $390.60 per year. Add in your Part B deductible increase going up by $21.50 per month or $258 per year, then your total increase is $648.60 or $73.44 more than the average COLA increase. Not too good. So what can you do? Well, you can try to get a lower Medicare supplement premium. You can switch to a lower plan, but you need to be careful. In most states, you do need to medically qualify. If you are in a birthday rule state, and you should know if you are, if you don't know, here is a list of states that have either a birthday rule, anniversary rule, or guaranteed issue Medicare supplement rights. If you don't have a healthy lifestyle, please consider adopting one as soon as possible. 80% of chronic diseases can be avoided or overcome, and that should help you avoid going to the doctor and spending money. And maybe, but very carefully, consider a Medicare Advantage plan. If you are from one of the states I'm licensed in, just contact me and let's see if there is a viable solution. All right, that's it for today. I do hope you found this helpful. Of course, these are estimates. Nothing is etched in stone. We will not know for sure until later this year, usually around November to early December. We will find out. If you have questions about what I've just gone over and when you are ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website, We will have an open and honest conversation about your healthcare needs and philosophies and budget, and I'll do my best to answer any questions or concerns that you may have. And once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course be available down the road for your support. To stay up to date and gain more insight on maximizing your Medicare insurance and perhaps your health, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.